Hey everyone, it's Hina Sheth here at Rebalance Physical Therapy and Wellness in Center City, Philadelphia, as well as on the main line in Narberth, Pennsylvania. And our clinic specializes in the spine, hip, the pelvis, and the pelvic floor. And we believe that your whole body works as a unit. It doesn't work in separate pieces. And so today I'm going to talk to any of you who might be suffering from painful intercourse after rectal cancer. Now, I know many of you out there might just feel that, hey, I should just be thankful that I'm alive and I got treatment and, I should be happy. But I know from many patients that we have treated here at our clinic that, quality of life and having a poor quality of life sometimes can be worse than actually going through the cancer treatment. And I'm not saying that all of you feel this way, but this is what some of our patients tell us, is that they're like, I used to have a great sex life before, and now that I can't and I have these other issues, it's more of a quality of life is actually worse than actually going through the treatment that we actually did. So I want to talk to you out there because for some weird reason, physicians are not paying attention to the quality of life issues that patients have, especially when it comes to intercourse and sex after a lot of these cancer treatments. So whether it's, breast cancer to rectal cancer to some other, pelvic cancer, when you have radiation and treatment down into the pelvis, all of that treatment actually can change the nature of the musculature in the pelvis. And when that happens, the muscles can become a problem, and that can actually lead to painful intercourse. And I am not hearing that many physicians are actually speaking to patients about this. And I'm also feeling like when patients do bring this up, there's not a whole lot that's actually being talked about and explained. And so that is why I wanted to create this video for any of you who might be having any type of pelvic cancer really, and have experienced or experiencing this and are trying to figure out what to do and how to get help and what can help. So what I want to basically show you at first is, this is a model of the pelvis. Okay, your spine. These are your two big pelvic bones back here. Here's your pubic bone in here. And then there's the lower part of the spine. And then again, here's part of your pelvis. Now, inside of the pelvis, obviously you have a bunch of organs, but you've got a lot of musculature. This musculature is called the pelvic floor. Now, when you're having any type of radiation treatment that's in and around this area, radiation, even if it's targeted, okay, it is going to change the nature of how this musculature and all the other tissue around it, because this model is actually just showing the muscles. It's not showing all the other tissue called the fascia, which is kind of like the glue that binds all of these muscles and organs together. But the fascia and the muscles, and I want you to think about the fascia as kind of like saran wrap that basically surrounds every single tiny little muscle fiber, and it goes throughout all the organs. So when you have any type of radiation, all of that fascia and musculature is also affected. And when it's affected, it can become tight and scarred down. And so this pelvic floor musculature, the role of it is to actually give function to going to the bathroom, peeing, for intercourse. Now, this is a female pelvis. So again, this is not geared just to females. Males can have this problem too. So again, if you're a male and you've had any type of pelvic cancer, colorectal cancer, things like that, then you might be just as affected with these things as a female. So, but for ease sake, I'm using a female model. So vaginal or, vaginal intercourse and rectal function. So that's what the pelvic floor does. And I said vaginal intercourse, but I also meant just intercourse in general. So the pelvic floor basically lines through those openings. So the rectum for a female, the vagina, male, the penis, and then the urethra, which is up and through here. All right. So if this musculature has to be soft and supple in order for things to go in and out of each of these openings, then you can imagine if this becomes tight and it becomes scarred down, then it's going to be really, really difficult for something to go inside or come out. So some of you who might be experiencing pain with intercourse may also be having difficulty with having a bowel movement potentially. Or some of you may be having bladder issues as well. Because again, if this musculature is scarred down, it can affect the urethra and the bladder, which is what you pee out of. So if that musculature becomes tight and scarred down, then this can now help you guys understand why intercourse could be very difficult and very painful for some of you. So now, great, you know what might be going on, but what's going to help it? So, pelvic floor physical therapy, this is what we specialize here at our clinic, can actually help many of you regain your quality of life in this area, and possibly many other areas too, because believe it or not, you may not realize that this pelvic floor can actually affect not only intercourse and peeing and pooping and things like that, but it actually interferes with functioning of the hip, and it actually can also interfere with functioning of the back and the abdominals, because this pelvic floor muscle is actually a core muscle. And so it can affect everything that it actually connects to, including the tailbone, because you can see that this musculature actually connects under the tailbone. So maybe for some of you guys, you might also say, hey, I had radiation, chemotherapy, and I'm having tailbone pain and I'm not sure why. So that could also explain why that could also be involved too. So the treatment for it is actually to go in and actually work on a lot of this musculature to start making it soft and supple, as well as all the other surrounding muscle areas of the hip, the back, abdomen, and all of the thigh muscles as well. Because believe it or not, what we found here at our clinic, and often what many people have actually discovered too, is that all of this other stuff becomes tight as a compensatory pattern, or perhaps you already had some tightness there. And so that all kind of plays into each other because again, the body is all interconnected together. And so the treatment needs to be is working on all of this, as well as working on the pelvic floor muscles themselves. Now, if you live in and around, and who does this? So I got to tell you who does this. So if you live in and around this area, I mean, no brainer. This is what we specialize in. We are pelvic floor physical therapists with an orthopedic background. We treat orthopedic and pelvic floor issues in conjunction all the time here at our clinic. And that's what we treat pretty much all day. So when you see a specialized pelvic floor therapist, that has a good understanding of how everything works, they can actually help to improve the flexibility and the suppleness back into this musculature so that you guys can then engage in intercourse and have some better quality and hopefully good quality of life back, even though you went through this process of cancer treatment, because we know how important it is that the quality of life come back for you guys as well. Now, we also do telehealth consults as well. So if you live within Pennsylvania, but you can't get to us because you're far away, then we can actually do telehealth consults where we can teach you, basically take you through an evaluation and teach you some of the things that you need to do. Now, we also have an online program. So for those of you who are past your treatments, you're in a good place in terms of, now it's just more of a quality of life issue, and you're not dealing with any of the chemotherapy and radiation. And if you get the okay from your physician to kind of resume normal life and possibly go back to physical therapy, then you can potentially try our online program that we actually created for those of you who cannot come see us, that you can actually follow through, and we teach you how to actually improve all of the fascial tightness that you might be experiencing in and around the spine, the abdomen, the pelvis, and the hip, and then also to teach you how to start releasing these muscles yourself so that you can start seeing improvements in these areas. And alongside with that, it's kind of an interactive program in the sense that you can ask us questions, email them into us, and we can actually reply back with video content, or you can actually alongside of it, have telehealth consults with us so that we can kind of give you some general guidance on what to do, and potentially if you need to see someone specific even further in your area. So hopefully this video was helpful to many of you who might be suffering from just the quality of life of just really wanting to regain that normal sex life again and just improve all of these things. And again, all of our information is in the information box below, including our program, our online programs, as well as how to contact us. And if you like these videos, definitely subscribe to our channel because we put out lots of content, and it's all very helpful to many, many people. As you can see, we have a lot of subscribers. So I hope you guys have a wonderful day. Take care, and hopefully we'll see or talk soon.